Imagine this for a moment. You're at home, maybe enjoying a quiet meal, watching TV, or sitting alone in peace. Everything feels normal until suddenly something goes wrong. A bite of food doesn't go down the right way. Your throat tightens, you try to cough but nothing comes out, no air, no sound, just panic. This is choking. And when you're alone, especially after 60, those first 20 seconds can mean the difference between life and death. Most people think choking is rare. It's not. It happens fast, silently, and often when you least expect it. And the scariest part, you may not be able to call for help. That's why knowing exactly what to do instantly is not optional. It's survival. The moment you realize you cannot breathe, cannot cough, and cannot speak, you must act immediately. No hesitation, no waiting. Panic is your enemy, action is your lifeline. First, try to cough with force. Even a small amount of air movement can help dislodge the object, but if nothing happens within seconds, you must switch strategies. Now listen carefully, because this is the most important part. You need to perform a Heimlich maneuver. Make a fist and place it just above your belly button. Grab that fist with your other hand, then thrust inward and upward hard and fast. You are trying to force air out of your lungs like a powerful burst, enough to push the object out of your airway. If that doesn't work within a few attempts, don't stop. Move immediately to a solid object nearby, a chair, a table edge, a countertop. Position your upper abdomen against it and drive your body downward forcefully. Use your own body weight to create pressure. Repeat this motion again and again until the airway clears. It may feel aggressive, it may feel uncomfortable, but this is not the moment to be gentle. This is the moment to survive. Now here's something many people don't realize. After 60, your reflexes may be slower, your swallowing muscles weaker, and your risk of choking higher. Foods like meat, bread, and even pills can become dangerous if not handled carefully. That's why prevention matters just as much as reaction. Always take smaller bites, chew slowly and completely. Avoid talking or laughing with food in your mouth. And most importantly, stay mindful while eating. Distraction can cost you more than just a moment. It can cost your life. But even with all precautions, accidents can still happen. And when they do, you won't have time to think. You'll only have time to act. So remember this: if you can't breathe, cough, or speak, act within the first 20 seconds. Try to cough, then perform the Heimlich. Use a chair or surface if needed. Do not wait, do not freeze. Because in that critical moment, no one is coming to save you. It's you saving yourself. And that knowledge, that readiness, can turn fear into power and a life-threatening moment into a story of survival. Stay aware, stay prepared, and most importantly, stay alive. Immediate action saves lives because in a choking emergency, every second matters more than most people realize. When the airway becomes blocked, oxygen cannot reach the lungs and, more importantly, the brain. Within just a few seconds, the body begins to react with panic, but within a few minutes, the consequences can become irreversible. This is why hesitation is so dangerous. Many people freeze in the moment, hoping the situation will resolve itself, but choking does not fix itself when the airway is fully obstructed. The body needs help, and it needs it instantly. Acting quickly is not just helpful, it is the only thing that can interrupt the chain of events that leads to serious injury or death. As people age, their bodies undergo natural changes that make rapid response even more critical. Muscles involved in swallowing may weaken, reflexes may slow down, and the ability to generate a strong cough can decrease. This means that once choking begins, it may become severe much faster than expected. Older adults are also more likely to be alone during meals, increasing the importance of self-reliance in those first critical moments. There is no time to search for a phone, No time to wait for someone to notice. The body is signaling distress, and the only effective response is immediate, decisive action. The mind plays a crucial role in survival during these moments. Panic is a natural reaction, but it can also be paralyzing. When the brain senses a lack of oxygen, it can trigger fear and confusion, making it harder to think clearly. This is why preparation and awareness are so powerful. When someone has mentally rehearsed what to do, their response becomes faster and more automatic. Instead of freezing, they act. Instead of wasting precious seconds in confusion, they move with purpose. Immediate action is not just physical, it is mental readiness transforming into life-saving behavior. Another important factor is recognizing the signs of a severe airway blockage. Many people assume that choking always involves loud coughing or dramatic gestures, but in reality, it can be silent. When the airway is completely blocked, a person may not be able to cough, speak, or even make noise. This silence can be misleading and dangerous. Immediate recognition of this condition allows for immediate response. The faster the problem is identified, the faster it can be addressed. Delayed recognition leads to delayed action, and delayed action reduces the chances of survival. Physical response must be forceful and intentional. The goal is to create enough internal pressure to expel the object blocking the airway. This requires strong, quick movements that push air upward from the lungs. Gentle attempts are often ineffective, and time spent using weak efforts can be the difference between success and failure. Immediate action means committing fully to each attempt, understanding that the body needs a powerful intervention to overcome the obstruction. Each second spent applying effective force increases the likelihood of clearing the airway and restoring breathing. Environment also plays a role in how quickly someone can respond. Being aware of surroundings and knowing where to find a stable surface can make a significant difference. In an emergency, there is no time to search or rearrange. Immediate action includes using whatever is available in the moment, whether it is a chair, a countertop, or the back of a sofa. The ability to adapt quickly to the environment ensures that action is not delayed by uncertainty or indecision. This adaptability becomes a critical survival skill, especially when alone. Confidence is another key element that supports immediate action. Doubt can slow response time, causing hesitation at the worst possible moment. When someone trusts their ability to act and believes in the effectiveness of their actions, they are more likely to respond quickly and with enough force. Confidence comes from knowledge and repetition, from understanding what needs to be done and accepting that it must be done without delay. Immediate action is fueled by this inner certainty, turning a moment of fear into a moment of control. Ultimately, immediate action is about taking responsibility for survival in a situation where time is the most limited resource. It is about recognizing that waiting is not an option and that the body depends entirely on swift intervention to restore normal breathing. Each second saved is a step closer to safety. Each decisive movement, a push toward recovery. The difference between life and death in a choking emergency is often measured not in minutes, but in moments, and those moments belong to the person who is ready to act without hesitation, mastering. The self-Heimlich technique is one of the most important life-saving skills a person can develop, especially after the age of 60, when the risk of choking increases and the likelihood of being alone during an emergency becomes more common. This technique is not just a piece of knowledge, it is a practical ability that can mean the difference between survival and tragedy in a matter of seconds. When the airway is blocked and breathing stops, there is no time to wait for help, and no guarantee that anyone else will be there to assist. The responsibility shifts entirely onto the individual, making it essential to understand not only what to do, but how to do it with confidence and precision under pressure. The Heimlich technique works by creating a powerful burst of air from the lungs that forces the obstruction out of the airway. This is achieved by applying quick, upward pressure to the area just above the navel and below the rib cage. The motion compresses the diaphragm, which in turn pushes air upward through the trachea, ideally dislodging whatever is blocking it. Understanding this mechanism is important because it reinforces why the movement must be sharp, strong, and correctly positioned. Weak or misplaced attempts may fail to generate enough pressure, wasting valuable time in a situation where every second counts. Learning the correct hand placement is a critical part of mastering this technique. One hand should be formed into a fist and placed slightly above the belly button, while the other hand grips the fist to provide additional force. The thrust should move inward and upward at the same time, targeting the diaphragm effectively. This movement may feel unnatural at first, but with practice and mental rehearsal, it can become more instinctive. The goal is to ensure that when the moment arises, the body responds automatically without hesitation or confusion about where to place the hands or how to execute the motion. Equally important is understanding when to transition from using your hands to using a fixed object. In some cases, especially if strength or coordination is limited, using a solid surface like the back of a chair, the edge of a table, or a countertop can produce greater force. By positioning the upper abdomen against the edge and driving the body downward, it is possible to create a stronger and more consistent pressure than with hands alone. Mastery of the Heimlich technique includes knowing how to use the environment effectively, turning everyday objects into tools for survival when needed most. Consistency and repetition are key to building confidence in this technique. While it may not be practical to physically practice full force thrusts regularly, mentally rehearsing the steps can significantly improve reaction time during an actual emergency. Visualizing the sequence, recognizing the blockage, positioning the hands, delivering the thrusts, and switching to a surface if needed helps condition the mind to respond quickly. This mental preparation reduces panic and replaces it with a sense of control, allowing the individual to act decisively rather than freeze in fear. Another crucial aspect of mastering this technique is understanding the physical sensations involved and being prepared for discomfort. The thrusts can be forceful and may cause temporary pain or bruising, especially when using a hard surface. However, this discomfort is insignificant compared to the risk of suffocation. Accepting that the technique may feel aggressive helps remove hesitation, ensuring that the person commits fully to each attempt. The priority is to clear the airway, and that requires a willingness to apply enough force to make the technique effective. Awareness of personal limitations also plays a role in mastering the Heimlich technique. Factors such as reduced strength, joint stiffness, or balance issues can affect how the technique is performed. Adapting the approach to suit individual capabilities is essential. For some, using a stable surface from the beginning may be more effective than relying on hand thrusts. For others, ensuring that commonly used areas in the home have accessible, sturdy edges can make a significant difference. Mastery is not about performing the technique in a perfect textbook manner, but about being able to execute it successfully in real-life conditions. Confidence grows from understanding, preparation, and the willingness to act without delay. When someone truly masters the Heimlich technique, they carry with them a powerful sense of independence and security. They know that even in a worst-case scenario, they have a tool that can protect their life. This confidence does not eliminate risk, but it dramatically improves the chances of a positive outcome. It transforms a moment of vulnerability into a moment where decisive action can restore breathing and prevent a life threatening situation from escalating beyond control.